Tasmyn speaking. So your GP has referred you.
As a coach, we will support people with physical health issues, so that could be, long-term health conditions such as type 2 diabetes or hypertension or pain management and things like that. We can then support people with mental health. So it might be kind of looking at the topics of nutrition, physical activity, improving sleep, reducing stress. We will kind of collaboratively work to come up with a solution together. They're the experts in themselves, they know what works for them, and we'll talk about what they've tried in the past, and then we can come up with that plan together.
Yeah. So you just do that one lap. Yeah.
So we might set some goals to focus on in between each appointment, and then we'll get back together and talk about what went well or not so well, and amend the goals and take it from there. The average is kind of 6 appointments per person. It's around about 45 to 50 minutes per appointment. We can do face-to-face here at the GP surgery, we can do telephone appointments, or we can have a video meeting. I am running some group sessions at the moment, and that's really, quite special because it's not about me, it's about them. They can actually learn from each other. Patients say that they have felt listened to, they haven't felt judged at any point, and they have the time to really open up as to what's going on for them. My hope is that they'll be their own coach one day. They won't need me, they'll come across a challenge and they know, I've done this before, this is how I overcome it, these are the tools I used, or this is the technique I used. Realising they can do this, they are in control, they are the one who has the power.
People have overlap between their physical and mental health, and when these things can be addressed in combination in a really supportive environment, I think it can have some amazing changes on their health and their well-being and achieving whatever goals they have for themselves.
There are limitations to what we can achieve with medications, and many of the problems that we see are just as much about people's habits, people's lifestyles, and these are really difficult cycles to break, and in a 10-minute appointment it's really difficult for us to scratch the surface.
Some people, you might say to them, oh, you need to do these changes, but actually that doesn't necessarily fit with their lifestyle. So then by having someone who actually explores that's so helpful.
Tasmyn has been very useful with diabetes patients, but also with patients with chronic pain, menopause patients, patients with asthma and COPD. These are long-term conditions, and the support that Tasmyn can give patients is very, very important.
I had a patient who was living with type 2 diabetes, and they'd lived with it for quite a few years now, maybe 5 or 6, and they knew what to do in a sense of they'd got all the information from the GP and other kind of educational services, which are great, what to eat, what not to eat, but for some reason we're kind of really struggling to implement those changes. What they'd been trying to do previously was implement every change at once. Once we kind of just discuss that all or nothing mindset and realise we don't have to suddenly try and become perfect if there is such a thing. That really improved their mindset going forward and made things more manageable.
Tasmyn has been with us here at Sands End for a year and a half. I think it's made a fantastic difference to our surgery and to our patients.